A dangerous and fast-spreading fungal infection is sweeping through healthcare facilities across the United States, and the warnings from scientists are growing more urgent. Candida auris, a drug-resistant fungus, is now present in 38 states, with infections surging in recent years. This highly adaptable pathogen is not only difficult to detect but also nearly impossible to treat in many cases, making it a severe public health threat. The Centers for Disease Control and Prevention (CDC) has classified it as an urgent antimicrobial resistance threat, yet awareness among the general public remains dangerously low. Unlike airborne illnesses like COVID-19, Candida auris spreads through contaminated medical equipment, hospital surfaces, and person-to-person contact in healthcare settings. It thrives in environments where vulnerable patients rely on feeding tubes, catheters, and breathing apparatuses, making hospitals and nursing homes prime breeding grounds. The fungus is particularly dangerous for those with weakened immune systems, including elderly patients, individuals with chronic illnesses, and those undergoing invasive medical treatments. While healthy individuals are less likely to become infected, they can still act as carriers, unknowingly contributing to its spread. What makes Candida auris particularly terrifying is its resistance to antifungal treatments. Some strains respond to a class of medications known as echinocandins, but others are resistant to all available antifungal drugs. In these cases, there is no effective treatment. Patients infected with the most resistant strains are left with little hope, as the medical community has no means of eliminating the infection once it takes hold. The consequences are often deadly. CDC data suggests that between 30% and 60% of patients who develop invasive Candida auris infections do not survive. However, because many infected individuals already suffer from other serious conditions, the exact mortality rate of the fungus itself remains difficult to determine. The rapid spread of this pathogen is alarming. In 2022 and 2023, reported cases surged across the country, with major outbreaks in states like California, Florida, Illinois, New York, and Nevada. While some states have reported only a handful of cases, the presence of Candida auris in healthcare environments means that even isolated outbreaks have the potential to escalate. Its ability to persist on hospital surfaces, even after cleaning, makes it a persistent threat. A single contaminated bed rail, medical device, or improperly disinfected piece of equipment can lead to new infections, allowing the fungus to establish itself in more facilities over time. The lack of an effective cure underscores the need for aggressive prevention measures, but the response from healthcare facilities has been mixed. While some hospitals have ramped up infection control efforts, others struggle with proper containment due to limited resources and inadequate awareness. The CDC has repeatedly emphasized the importance of early detection, improved diagnostic testing, and strict hygiene protocols, but these efforts are only as effective as the institutions implementing them. Delays in identifying and containing infections can allow the fungus to spread unchecked, increasing the likelihood of outbreaks in hospitals and long-term care facilities. Despite the severity of the threat, public awareness remains shockingly low. Many people have never heard of Candida auris, even though it poses a growing danger in medical settings. Unlike more well-known infectious diseases, this fungus does not generate widespread media attention, allowing it to spread quietly while healthcare workers battle to contain it. With no vaccine or reliable treatment available, prevention remains the best defense. Patients and their families should be aware of the risks and take precautions when visiting hospitals, including practicing strict hand hygiene and asking about infection control measures. The rise of Candida auris is a stark reminder of the growing threat posed by drug-resistant pathogens. As bacteria and fungi continue to evolve resistance to existing treatments, the medical community is running out of options. Without significant investment in new antifungal drugs and stronger infection control protocols, outbreaks like this one will only become more frequent and more deadly. The fight against antimicrobial resistance is far from over, and Candida auris is just the latest example of how unprepared the world remains for the next major health crisis.